Hi everybody, it's Dina here from Shine Dental Clinic. I hope you're well. Sorry it's taken us a while to get back to doing these videos. We've had a busy old time of late, but you're going to hear some separate messages about that. So one of the topics that we get asked a lot about is veneers and composite build-ups. Everyone nowadays wants to try and make their smile better, and they want to understand about the different treatments that you can have done at a dental clinic. So veneers and composite build-ups kind of go together, so we're going to split this talk over two posts. So the first one we're going to talk about is veneers, and the second one is going to be about composite build-up. So today we're going to talk about veneers. So the big question we often ask is, what are veneers? What do they do? How are they different from crowns? So veneers are a thin piece of porcelain that go on the front of the tooth, and we can use them to improve the colour, the shape of the tooth, and even the position. They look fantastic and a really good way of kind of improving your teeth. The downside to them, unfortunately, is that we do have to remove some teeth. The amount we remove is minimum, but ultimately we're still taking away a healthy tooth to do that. Now, depending on the position of people's teeth, sometimes veneers themselves aren't enough, and we have to consider other ways in how to move them to get them into a better position. So really, if you're thinking of looking at improving your teeth, it's not just about kind of just the colour, it's the position they are as well, to see kind of what the best option is for you. So I've got a list of questions here that I've been sent. Can everyone have veneers? In theory, yes. Most important thing is that your teeth are healthy, that they're well maintained and they're looked after, and then definitely that's something that you can have a chat with your dentist about to see whether you're appropriate. Then I've got, can I get them done in Turkey? I think this is more obviously just in relation to whether you can have veneers done abroad, and of course you can have lots of dental treatment done. I think the only thing I'd always point out to patients is that, like all dental treatment, it needs to be followed up and monitored and maintained, and if you're having it done abroad, then that sometimes can be a bit more trickier to do and harder to kind of manage. And what is the risk? So as I mentioned earlier, the downside to veneers is that you're having to remove tooth, so you're taking away healthy tooth substance to obviously improve the appearance of your teeth. The other downside to them is that even though they are bonded to your teeth, so they're glued on and they are very strong, there's still a risk that they can break and crack and become discoloured over time. But these things have all become far more reduced as materials and that have improved. And what people would be perfect for this type of treatment? Ooh. Again, a bit like what we talked about before, someone who looks after their teeth, is well maintained, they haven't got any underlying decay or gum disease issues, and then absolutely that's something that people can then have a chat with and to see with their dentist to see whether the veneers are the option for them. The great thing now is that we have a lot of digital smile designs that we can do. So as for example, at our clinic, if someone's interested in having veneers done, we can take pictures of their mouth, we can take scans of their teeth and actually give them a really good indication of what their teeth will look like with veneers. The other thing that's always really important to mention, as with any type of dentistry, that it has a lifespan. So veneers on average will probably need to be replaced every 9 to 10 years. So that's another thing to factor in, that if you're thinking of having it done, you've got an ongoing cost that you'll need to consider down the line. So that is veneers. So I look forward to speaking to you shortly about composite build-ups. Thank you.